Hi, everyone. Welcome to the next show. We are going to talk about how anybody out there can keep their brain sharp with each passing year. Very important topic. I know it concerns many people. Nobody wants to have cognitive decline. And we're going to talk about how anybody can achieve this entirely naturally. And for anybody who enjoys our discussion, please check in the links down below in the description. We have a separate channel where we upload talks, discussions, the three of us talking about your health concerns. Okay, so let's get going then. Keeping the brain sharp naturally. One of the first things that anybody can think about is challenging their brain as much as possible.
That's so true, Suneel. That's such a great topic to talk about. I think we need to really rethink on how we think of the brain, and we need to think of it as a muscle. All right. We talked about other podcasts. If you don't use your muscles when you're in the hospital, you lose it. And the same with the brain. It's really no different.
Yeah, no, I completely agree. I think there's a lot of activities you can do to challenge the brain and to keep it sharp and to keep it working like a muscle. And not all of it has to be painful. You can focus on things you like doing, but they need to, a lot of the time, be new skills or skills that really focus you. I mean, people do things as basic as crossword puzzles and things like that. But I think it's very important to try to enjoy the skill you're getting into. Don't you guys agree?
Absolutely. And that was such a great point about the brain being like a muscle, because that's often forgotten about. And absolutely it is. And the more you train it, and nothing is guaranteed. Of course, cognitive decline can happen to people who are very sharp, but it's all about lowering anybody's risk. And definitely there's a ton of research out there that if you challenge your brain, especially above a certain age, keep learning new things. And I always like to set a challenge actually to anybody watching. Please ask yourself, what do you know now that you didn't know 6 months or a year ago? Could be a language, could be a musical instrument, could be a card game, anything at all, just something new which has tested and rewired your neurons a bit. It's fantastic for the brain.
That's so true. And again, it's all about going to retirement. We need to retire our brain. And I think people think over a certain age, you can't lead or learn new skills. And I know many people and many physicians that just go on, and lots of people have second careers. And it's just, we know that keeping your mind engaged post-retirement and everything just keeps the rates of cognitive decline down. And that's a proven fact.
It does, absolutely.
I think people get afraid to try new skills too as time goes on and try to learn new things that they haven't done before, because that's really when you see a lot of the change occurring in the brain. That's really, the word is challenge, and that's what we're talking about right now. And you really don't challenge yourself by kind of doing the same old stuff, even though some of that can be very, very important. But I think looking at new things you haven't done before, trying to learn a new skill is really important. And there's a lot of stuff out there that you can explore, especially with the amount of information that's at our fingertips these days. There's a lot to explore and a lot of new things that you can look into. So I would highly recommend that.
There is. I don't want anybody out there who's watching to think you can't learn something new. I don't care whether you're 75, 85, or even 95. I meet 95-year-olds who are like 70-year-olds. I mean, it is amazing what anybody can achieve. Of course, it is a challenge, but you're awesome and you can learn new things at any age. And I get a bit ruffled whenever I hear anybody say, oh, I'm too old to learn. Or what I see more is people suggesting that anyone who is older can't learn new skills. Absolutely not. Can learn new skills at any age.
It's so true. Your age is really just a number, right? I mean, you can just learn so many new skills, and really it's not about, being too old at all.
Yeah, it could be something very simple. It doesn't even need to be a musical instrument or a language. It could be anything like a dance routine, a new exercise technique, anything, just something new. So that's the first point we'd like to make, challenging the brain in any way possible. Second point we'd like to touch on is exercise, just the wondrous nature of exercise to help with potentially any cognitive decline is also backed up by a lot of research.
And this goes with the whole mind-body connection, as we've, talked about many times before, just, on our podcast and off is, you can't have a healthy mind without a healthy body. And I think that's the really main thing that we want to really drive down here is that, your mind and your body are not disconnected. Your mental health is equally as important as your physical health.
Yeah, no, I think there's very good data behind exercising regularly and maintaining your cognitive abilities. I mean, it's been proven to decrease inflammation over time. It's been proven to increase memory. Exercise, it improves many aspects of your life, but concentration, your ability to form new memories, it's extremely important and cardio exercise is very important as well as strength, correct?
Correct. Yeah. And you can start off if you don't have an exercise routine that right now, just start off with walking. I'm not a fan of any arbitrary number. I know people say 10,000 steps. That might not be realistic, but walk at every opportunity you can. Is utterly magnificent. Out in nature.
And
Great exercise.
I can't stress that enough. I mean, you really just have to find something you enjoy doing, because if you don't enjoy doing it, you won't do it. And if you just cut out, 20 or 30 minutes out of a 24-hour day, if you think about that, it's actually really not a lot of time. And sometimes we can actually think more about not exercising than just doing it. But it's true. You should be learning and be realistic with yourself. You're not going to do it every day, but that's just life.
Yep.
No, it's true. And you mentioned strength training, which I've made videos on as well. It can start off very light, just 20 minutes, 3 times a week, light dumbbell exercises, use resistance bands. But yeah, it's such a small time commitment, as you alluded to as well, Peter. I mean, I always say I don't accept excuses at any age in the nicest possible way, but I talk to people at all ages, and absolutely this should be a priority. And I think if you have retired and you able to make this a priority, then absolutely you should have the time. Just even 20 minutes here and there can be extraordinary, and it is backed up with a lot of data.
It's so true. The other thing that affects so many people, and we're talking about keeping your brain sharp, is anxiety and stress. And I know for myself that for me, even throughout my career as a physician, we always try to practice what we preach, but regular exercise, I can't tell you how much better I feel mentally and physically after exercising. And I tell my patients, that's, for mental health, I think that's one of the biggest ways to improve mental health without medications. And I know that I couldn't live the way I do without it making part of my life. I'm sure you guys probably feel the same. I know you guys exercise a lot.
Oh yes, very much so. Yeah. I mean, I've never had a workout and not felt amazingly better afterwards. And the funny thing is, it's always when I don't feel necessarily, because everybody's human, I don't feel like doing exercise on one particular day, and then I'll go and do something and then I'll feel great. And I believe that can be the case at any age. But you mentioned, stress and anxiety. So always something which can affect the brain in a negative way.
Yeah. I mean, the other thing, really deep breathing, I don't think we actually realize the importance of it. And in my cardiology practice, I really emphasize this with patients because of just the anti-anxiety, effect of taking deep breathing. So when you're taking a deep breath, your mind really feels that your body is not in a state of panic, and it actually releases, just a calming effect. And not only does it lower blood pressure and other issues, but actually that over time really just helps reduce stress in your brain.
I think the interesting thing about stress and anxiety is we don't give them enough respect for how much kind of damage and how much they can cloud our minds. I actually, it's really interesting. I had a patient once who had severe anxiety, and it really wasn't picked up. As a matter of fact, they got the diagnosis of dementia. And so they were sent in for that diagnosis. And after it became clear, talking to the family and getting to know everybody that was involved, this was all anxiety. And the person had developed a really pathologic anxiety disorder. And once we figured that out and got the person treated, believe it or not, their memory cleared up and they started doing a whole lot better. So it was masking as dementia, but it was really anxiety and stress that had kind of taken over. So I can't stress enough how important it is to really keep those at bay and find activities to keep those down.
You got that. We can't stress enough, no pun intended, how important it is to get stress out of the picture. What else should we talk about? So let's talk about insulin resistance. And there is a school of thought which I actually subscribe to, that dementia is almost type 3 diabetes, because there's such a strong link with insulin resistance. And sadly, so many people are insulin resistant now. I've made lots of videos on this for everyone out there, but you want to touch upon that in terms of if you do have pre-diabetes, type 2 diabetes, how it could be naturally reversed even in anybody's 60s, 70s, or 80s?
Well, I think the main thing here is that we don't realize is that sugar shrinks the brain, right? I mean, and that's the whole thing where type 3 diabetes, as you're talking about, and just all, what we talked about, all the processed foods, the sugars, the seed oils, really not only have a toxic effect on your body or cardiovascular system, which is my specialty, but your brain as well.
Yeah, that's absolutely true. And not to mention that, insulin or glucose floating around the bloodstream unchecked. I mean, you can have problems with your electrolytes because of that. You can have swelling, decreased fluid moves in and out of various cells based on the electrolytes, sodium, things like that. And glucose can play a role in that. So you can imagine that an important organ like your brain that's having these fluid shifts all the time because of an inappropriate substance floating around your blood in too high concentrations is really, really bad. And yes, it can absolutely, without question, contribute to worsening memory and cognition.
Okay, everyone, I'm going to interrupt this fantastic discussion for a moment to tell you about our amazing expanding natural supplement store, my uniquely formulated natural supplements. We have immune support, bone support, memory support, heart support, and sleep support. Links down below. High quality supplements. We're very proud to be made in the USA and we work with a veteran owned company. I'm also very excited. Keep an eye out for this. Our upcoming organic chai tea mix based on the tea that I've been consuming for many years. A health and well-being tea. ohighwellness.com if you're in the USA, North America. ohighwellness.co if you're in the UK, Europe. Check the links down below. Okay, back to the discussion.
It sure does. We know that, increase sugar levels, insulin resistance, glucose intolerance, diabetes has a drastic effect on your vascular system. And so, we always talk about cognitive decline and people always associate it with Alzheimer's. All right.
Yeah.
But in reality, we don't probably stress enough the fact that our vascular system of our brain and the small little microvessels that permeate through the brain get affected by excess sugar and they get clogged and they get plaque just like other vessels in your body.
Yep. Very true. Yeah. So practical tips. If you have insulin resistance, pre-diabetes, type 2 diabetes, whatever you can do to reverse that with your diet, minimize those sugars, processed foods, optimize protein, stay well hydrated as well. And if you have excess body fat, losing that could really help. Now, this is always there's two sides to this coin because there is evidence that at the more extremes of age, being too slim is not a good thing. People can be more frail. And it's always interesting. I've seen lots of studies like that. Now, that's not to say you should have excessive body fat, but sometimes having a little bit extra isn't necessarily a bad thing.
No, I agree. I mean, you have to also think about like muscle mass. And I think people maybe get obsessed. We may think that, you should get as skinny as possible. And then, but in reality, that's maybe not the healthiest way. It's really just of what you're eating. And you need to come really like a comfortable sense of what you can eat and that's sustainable and that's actually healthy. And that ties back to what we just talked about too, is exercise. Like I don't have many patients that exercise a lot that eat junk food or eat really healthy. It's just a positive snowball effect. And every topic we're going to talk about really ties together.
Absolutely. Yeah. So let's move on now to staying socially connected and the very strong link that exists between being as socially engaged as possible with the right company, not people that you don't like and are going to annoy you and irritate you, but the more socially engaged you are, the better it is for your brain and lowers the rates of cognitive decline. This has been shown over and over.
It's so true. I mean, I heard a crazy, staggering statistics that loneliness is more toxic than even smoking about 15 cigarettes a day. If you can bleed out, right? And and we underestimate loneliness, which goes back to anxiety and stress and people, and you may not realize it and present differently, excess fatigue and tiredness and stress. It just all snowballs together.
Yeah, that's right. And there might be a subset of people, small percentage, who like being on their own. That's fair enough. Horses for courses. Everybody is unique. But I would say definitely most people out there are social. And if you're feeling lonely, if you know that loneliness is an issue, then that's when it can really start to affect your mind.
Well, absolutely. I think there's a lot that's gained for us humans to be having conversations with each other. And I think, there's a lot of that goes into a conversation cognitively. We learn a lot just watching each other and talking to each other. It stimulates our brain. There have been a lot of studies that show the way that where the brain lights up, how it functions while you're having a conversation, while you're thinking, while you're reading body language. It's very important to be social. And I think there are a lot of social cues and a lot of social things we do that we don't even realize we're learning. We're working on that brain function. We're working that muscle. I think it's very important. And I think when you leave all that, when you don't have that regularly, it can cause a lot of problems. Now, there are a lot of ways to address it. There are a lot of things out there you can do to get involved with other people. The good thing about the internet now and being online is there's a lot of ways to search for local clubs and local activities that are, very social events. So I think now more than ever, you can get more involved.
Exactly.
Yeah, it's really just being socially engaged. And I think that we all have like different concepts of what that is. And it doesn't mean like, you need to go out for dinner and a bar and all this stuff. It's just, connecting with friends that maybe you lost with, connection with, I tell you, I just had a very dear friend that I had not seen in 6 years because of the pandemic. And I just had him over visiting with his family. And, I can't tell you like how good that was and how good it'll make you feel when you just stay connected with people that matter the most to you. And, as we all, have so many friends and go through life, we find the people that make us feel better. And I think those are the people that you want to surround yourself with. And that's kind of my idea of what social engagement would be.
Yeah, that's a fantastic point. Okay, we will talk about drugs and medications in a moment because I've got some thoughts on those drugs which are prescribed for some cognitive decline and also over medication. But I do want to touch upon natural supplements because there are lots of natural supplements out there which have shown potential benefit as well in terms of helping to slow down any cognitive decline. The two which come to mind, which I've seen a lot of research on, ashwagandha and ginkgo. Yep, both of those. B vitamins are important as well for growth.
And again, that goes back to how diet affects your brain health, right?
Exactly.
So
yeah,
and these supplements really have been shown to increase clarity, focus, boost overall just memory, and these are have been around for a long time, and it actually really work. And I think that in combination with everything, again, here we go on the list, and these all things just add together.
they do. Yeah, and there's some terrific research, and we will come back to talking about that another time. Lots of natural compounds out there which are very, very good for the brain, anti-inflammation, antioxidant effects. So let's go from that to talking about prescription drugs. And a lot of people out there, this happens in the primary care setting,
That's right.
will start to have some worrisome signs of cognitive decline. It's so very sad when this happens for both the person and the family. And there are various drugs out there which are seen as first-line drugs. You want to talk about these, Ben?
Absolutely. This happens a fair amount. So typically what happens is a family member or a friend or someone will notice that there's some cognitive decline in a person. Sometimes they notice it themselves and they'll come into the office, and it is very common that the physician will immediately start the person on various medications. So there's a couple out there. One is called memantidine. You guys may have come across it, maybe not. And the other one's called Aricept with an A. I can tell you these are kind of the medications that are typically given for the condition called dementia or memory loss when it's getting moderate to severe. The problem is they don't work very well. So even the data shows these do not make a major difference in the course of treatment. They're really just all we have. So there's a lot of new drugs on the horizon that are being investigated. Most of them are not particularly promising. I'll be perfectly honest about it. And some of them are outright dangerous, the ones I've looked at. So I think that's really why people are so interested in this topic and why there's so much kind of investigation and looking for ways to treat this, because there really, in terms of the pharmaceutical industry, not that many medications that they're offering that are really effective at all.
That's true. Yeah, I'm really not impressed with the data. Is very iffy for these prescription drugs, which are often very expensive as well and minimal benefits. The other topic, which I know you will have something to say on, Peter, about, is the topic of over-medication. And I think this is a massive problem, and it is fueling cognitive decline in people in their 60s, 70s, and 80s. People are being over-treated for blood pressure. People are being over-treated as well. So there is a link between over-treating somebody's cholesterol as well, because the brain is 60% fat. So you want to be very careful. We're going to talk about statins in detail very soon in another show. But what are your thoughts on when you aggressively treat blood pressure and somebody's not getting enough oxygen to their brain?
Well, that's a good point. And, you need perfusion of your brain. And so essentially, we can't over control blood pressure and underperfuse people. And just like any organ, if it's not getting the blood supply it needs, it's not going to function appropriately. But, even with regards to medications, and this breaks me in my clinic when I see patients, and you may be put on a lot of medications, and you may think that well, I'm this age, that's just the age that I should feel like brain fog. And people kind of think, well, yeah, if, and it's tough to say because you've never been the age you're at. But I can't tell you enough that you should always just go through the medications, because I'm just big about like de-prescribing. We've touched on this in other video podcasts, is that brain fog, or just that feeling where you just can't get your clear thoughts, doesn't always correlate with aging. And there might be lots of medications. In my world there are, and a lot of actually, blood pressure medications. So it's really about tailoring the blood pressure medication specifically to you and having that conversation, with the doctor that's taking care of you.
True. And I always advise anybody on blood pressure medications, if you get a home blood pressure machine, it can be truly transformative. Hopefully most people out there have one if they have blood pressure issues. But if you are on 2, 3, 4 pills and you're testing your blood pressure at home and the top number systolic is frequently in the hundreds or 90s, then you very likely are being over-treated for blood pressure. I mean, even if it's around 110. So that's a discussion with your doctor. It's so very sad. But yes, if you're not getting enough oxygen to the brain, that is going to make you not feel good and have some cognitive decline.
Yeah. If you're at your doctor's office and you're having a blood pressure checked and it comes back elevated, have them check it at the end of the visit. And I do that all the time, have them check it in both arms. But you'd be amazed, that of how much it can drop. So, we call this white coat hypertension, whether it's true or not, but without a doubt, like just checking at the end can really help a lot.
Exactly. Okay, let's finish up appropriately with sleep and the importance of getting a good night's sleep for keeping your brain sharp.
Yeah. No, I think sleep is absolutely mandatory. That's when your body does most of its repair. That's when memories are formed often and solidified. So, sleep and getting to the deep stages of sleep is very important. It can be hard to achieve it though, can it?
It's so true. I mean, I really love talking about sleep, and I have to be probably the worst sleeper of my hair. And so if you think about, I think you just have to think about sleep as a different process. We think of it as getting rest, but actually it's kind of like cycling down to your brain, and it's actually rinsing your brain in a sense. It's hitting that reset button. It's calming down inflammation. We know that with heart disease, that's important. We know that people get less than 6 hours of sleep a night are at increased risk of heart disease. But at the same time, like, you don't want to be sleeping all day, because that also probably would link to heart disease as well. But it's a rinse for your brain. It just cleans out the bad stuff. And if you're not getting sleep, your brain just does not have time to repair the inflammation.
That's right. And I'd also recommend, stick to those good sleep habits of winding down at the end of the night, keep your room cool. And I'm not a fan of napping. I think a lot of people get into this habit, especially after retirement. Hopefully that's not you, but will nap during the day and then can't sleep well at night. I think sleep should just be at one portion of the day, which is during the night.
I couldn't agree more.
Yeah. All right, everyone, we will sum up as usual our thoughts on this topic. I will finish up by saying that keeping your brain sharp is something that you can be very proactive with. Don't let anybody tell you ever that anything is inevitable. It is not. Of course, we're playing a risk game. Things can still happen randomly, but all anybody can do is their very best. So remember everything we talked about in terms of being proactive, get exercise, reverse any insulin resistance, work on natural things. Again, your diet, focus on stress, focus on sleep, and learn new things. That's one of the biggest things I think when I talk to people that they could be doing, which they are not. So keep thinking along those lines, and hopefully your brain stays sharp for as long as possible.
That's so true, Suneel. And everything we've talked about costs nothing. And I think that's the most important thing to drive home here. And again, we haven't really touched on medications, and really it's just, healthy body, healthy mind.
Well, I would say start now. So these are the kind of habits you can get in early. You can get in now and keep them going for quite some time. And I think you will find they pay off.
Absolutely. Well said. Okay, everyone. Thank you for watching. We wish you the best of health. Keep going, be proactive. And once more, check out our separate channel in the links in the description down below. We will speak to you again very soon.